And
yes.
one of the things that we're hearing a lot about right now, which seems to relate to this, is the Section 75 privatisation regulations.
Yes.
Can you tell us a bit about what difference those regulations will make to the NHS?
Yes, I mean the Health and Social Care Act itself was in many ways quite vague about exactly how CCGs were meant to commission services, the detail of what was expected of them. And that level of detail is something that normally comes out in what are called secondary legislation and regulations. Those sorts of secondary legislation and regulations tend to go through on the nod through Parliament without even a debate. That's the standard practice. But luckily campaigners have picked up that these regulations that are going through Parliament just now are really important and have actually forced a debate on this through campaigning. I think that shows the power of campaigning. But also the importance of being alert to what's really going on, because the new regulations are actually going to force CCGs to put all contracts, when they come up for renewal, all of them out to tender, competitive tender. That includes hospital contracts. And the problem with that is that that will lead to huge amount of work for CCGs, because the cost of actually running even one competitive tendering process is thousands of pounds. If you're having to do that for many services, you're talking about tens, hundreds of thousands. In fact, the whole cost across the country could be in billions of what we call transaction costs. It will also absorb all the time of the CCG, the clinical commission groups, and part of their job is supposed to be looking at improving healthcare in the community and lots of other things. They will be too busy just running tenders. But also, if the private sector competes and wins a lot of these tenders, which they may well do because they can undercut on price, then they tend to take the more straightforward kinds of cases that you can, the costs are predictable, so they can predict what kind of profit they can make. If they take those cases away from the NHS hospitals lose a very important funding stream that they depend on, because what happens in an NHS hospital is that the more straightforward work subsidises the more complex urgent care.
Because the government pays money for the money follows the patient.
Yes, so every item, and that's a relatively new thing over the last few years. Every single thing that happens in a hospital, money attached to it. So if somebody comes into hospital and gets a hernia operation, the hospital gets some money. If somebody comes in and gets treated in A&E, the hospital gets some money. Or if they need an emergency operation, the hospital gets some money. The interesting thing is that the payment for more routine stuff is better. It's a better rate of pay than the payment for urgent and emergency stuff. So there's more money to be made from providing lots of hernia operations and cataracts and hip replacements and all those things than from providing emergency care. So routine care subsidises emergency care. They cross-subsidy, and the whole thing together becomes an economically viable package that enables a hospital to run. If it loses its straightforward cases that bring in that funding stream, it's left with the really expensive stuff, which can rapidly become unaffordable. We're already seeing hospitals teetering on the brink of bankruptcy because for various reasons their funding has been cut. It doesn't take much more to tip them over into being bankrupt. That then leads to hospitals either closing or merging with other hospitals to try and stay afloat. And that's part of, I think, what we'll see that in the future, fewer and fewer hospitals, bigger and bigger ones coming together, bigger hospitals to try to survive financially. Especially if the private sector is allowed to remove the funding stream that comes from providing routine care. So that's really the fundamental risk. It doesn't bother me if the private sector's there and is trying to provide some services that some people might want. It's because of the impact and the dynamics and how it could change the care and destabilise the provision of care in the NHS as a whole that worries me. As well as that, of course, the sheer waste of money of running a competitive market economy when we're already cutting services because we haven't got enough money. It's already estimated that the cost of running the market up till now is about £10 billion a year. That's going to be much more if these regulations are passed. It could be 20 billion a year, 20% of our budget. Could even be 30% of our budget, 30 billion a year, because that's what they spend in the United States, 30 cents in every dollar on administration costs. And we could be moving in that direction. So for those who say we can't afford the NHS as it currently exists, I say we can't afford the market.